This is an amazing, magical place where miracle happens every day in our institutions. And the last 10 years have given us a tremendous opportunity to provide our community with the best service there is around.
California Hospital is a true safety net hospital. 85% of the patients that we care for in the emergency department are underinsured. We just want to provide everybody the best care and the best experience possible.
Every day, you can make a difference in people's lives who need help. That's our responsibility, and when you sign on to the staff here, you understand that that's part of the mission. I'd say the nurses up on the floors are the ones that really are the glue that hold everything together here at the hospital.
People who come to the emergency room, they're scared, they're in pain, they're upset, there's a lot of adrenaline flowing. And the more you treat them with respect and kindness, it really works for everybody in the end.
The nurse would just come, like, I guess he seen what type of person I was, and like he'd just check on me every day, you know. Like they were real like family.
We have this little extra thing that you can't quantify and the money doesn't buy and no drug will substitute for, but that our staff has.
I wasn't merely treated at California Hospital, I was cared for.
They're in my heart. Like, I always think about the doctors and the nurses that I had there. I get so emotional when I think about it because, like, they're part of my resiliency.
The secondary caretakers up on the floor, they're the ones who have this, this link with the patients and provide this human kindness that eases suffering, eases anxiety, and helps people get better.
I want to know that you feel safe, that you know you have someone to rely on. Going that extra 5 minutes of the day and taking time out just to talk to somebody.
Whether it's talking to them about, you know, what they did for a living, where they grew up, their situation, just showed some human kindness to the patients. Not only on a clinical level, but to emotionally help them as well.
You understand sometimes why they do cry, because they had such good care, and you do become a friend, or you do become someone that they will kind of hopefully remember.
I'm pretty sure it was Dr. Hinneke that came in, and he tells me, Nelson, you have the name of a fighter, and thinking obviously Nelson Mandela. And to me, that was kind of like a turning point, thinking that things would probably be okay from here.
It's just all off of love and care for what they do. I appreciate that. So
even just offering them a nice cup of coffee or just some of your time.
One of my nurses, you know, she really wanted to make my room feel,
sorry, I'm getting a little teary-eyed.
like home, so she decorated my room, you know, as I was coming back from surgery.
It means a lot to you when you hear that you did something to help them out.
I asked to be taken to the hospital where I have my regular physician. They said, sir, you need to go to the closest hospital to which we can take you. And that turned out to be a real blessing, because that hospital was California Hospital.
We're here to take care of patients regardless of their background and their situation, and we treat everybody with respect. We treat everybody with open arms.
Here in California, we make a difference. There's a lot of people that come in this place that don't have access to quality care on a regular basis, and they appreciate it. Right? At the end of the day, they come back and say, I really appreciate what you've done and what the staff here have done. They've made me feel cared for, and I haven't felt cared for like that in a long time, and I appreciate it.